Hello, my name is Mario Ravić and I'm leading digital health and IoT business unit in Ericsson Nikola Tesla. Today I'm going to present the role of IT companies in innovation practices for healthy aging, a lecture created together with Professor Orešković. So the role of IT companies in innovation practices for healthy aging is a very complex subject, because IT companies traditionally are the vendors that are delivering software solutions, and healthcare is not that simple as a field, and elderly are definitely a type of user group that requires additional interaction, knowledge, and totally new skill sets to develop something for them. So few things about the elderly. There are preconceptions definitely in the society about the older people, that they are old, not productive, and cost the healthcare a lot. And healthcare in parallel is developing different delivery models, like value-based healthcare model, to be more efficient, to deliver more value for the same cost. And getting back to the preconceptions, besides the people are not productive and they're costing the healthcare a lot. What we know and what we found out through the article written by Professor Orešković is that we don't know a lot about aging process, because we don't have periods in history where we could learn about it. And if we are developing IT solutions for active, independently aging, we are in a problem, so we need to learn from the experimentation on site. Besides those preconceptions, there is a widespread perception that older people are unfamiliar with technology, which is true in a lot of cases, but in some aspects of it, it's not true, because a lot of people are using Facebook, like 54% of them in Europe, 30% regularly using YouTube, 25% using Skype. So they are adapting to new technologies, but that is different through different geographies, culture sets, and many other aspects of their existence. On the other hand, just to bring to the table are the tech companies that are seeing a huge opportunity in the healthcare sector, like Amazon, Apple, IBM, Google, and they're trying to use new technologies to bridge the gap of the healthcare needs. And these new technologies are AI, artificial intelligence, and machine learning. And what we know about artificial intelligence and machine learning is basically our expectation that it will solve all problems, but in order to act, we need data for AI and ML. And that data is not available always and in the same quality. So there is an emergence of digital tools as well that is pulling out the data from clinical and not clinical contexts. And basically that data is also giving us a possibility to open new delivery models in healthcare. At the end, in order to come to the holy grail of predicting the future for diseases, especially for older people, we need some time and we need some data for it. So when talking about data, we created in Ericsson Nikola Tesla a smart home system that basically is collecting the data and learning out of that data from home. And when we learn, we create patterns of our behavior. And when we create patterns of our behavior, we are able to act on those patterns. So coming back to the older people, and designing a system to the older people poses a lot of challenges to us. And some of them are on knowledge and experience, cognitive characteristics of older people, their social networks, and many other. One thing that is very, very notable is they don't like obtrusive technology. So technology needs to be around them, not to change their ways of life. So we did not have microphones, we did not have cameras, we did not have anything that is basically affecting their quality of life in our project. And what is Smart Habits? Basically, Smart Habits is a end-to-end solution that is using affordable and unobtrusive smart home sensors to detect motion, power sensors, door, window, or environment sensors, And basically we are collecting data from it, learning and notifying on unusual patterns, the family members and caregivers, all in all making the usage of that data from home to get people monitored in terms of independent living. So what we are doing is basically providing two new things in the analytics layer. We are providing the pattern recognition engine and an anomaly detection engine, and by having those two work together, we can definitely notify and provide actions based on non-normal behavior. In one pilot that we did with Foundation for Independent Living, one of the foundations for independent living, we noted that our system learned per single household, and there were 11 households in the pilot, 23 patterns in 30 days. And you can see those number of patterns being learned per sensor on a graph. And what stands out is the luminance sensor having more than 5 patterns on average per day being learned in a system. That means turning on and off the light can tell you a lot about person's behavior in a long term. And rule details view shows us how we can set up the rules based on data. Here is the example of the manually set up rule for a motion sensor that is basically giving you an alert if there is no motion in between 7 and 12 p.m. And on the graph horizontally, we can see the dots in the timeline for the motion sensor. In the single household, vertically, we can see days in a month. So when we observe a whole month, we can see really the activity and how the activities are clustered around certain periods of time. System can, by auto-learning, can basically provide you the movement stop boundaries, or you can decide on yourself where you want to have the alert regards to movement being executed. So innovation that we basically developed here and worked out very well is the applied analytics component from privacy-aware habit pattern recognition. Sounds very complicated, but more or less it's a system that learns patterns, taking privacy in concern, and learns how to detect anomalies, which are very different from case to case. And that system can be used for better care assistance for chronic diseases, improve home-centric healthcare services, and more efficient home building automation and security. Coming back to healthy aging, I think health IT companies can play a major role out there, but definitely with a lot of focus on end users, with a lot of focus on unobtrusive technology, and with persistence in machine learning and AI application to context of healthy aging. Thank you very much.